So we've made this video to explain what the PACT form is, what it does, and to demonstrate how to talk to patients and family members about it. PACT stands for Planning Ahead for Care and Treatment. The PACT form was created about a year ago by hospital consultants and GPs in Milton, Keynes, in a response to an observation that some patients were perhaps being admitted to hospital when they or their family felt that they would be better cared for at home. It felt like people perhaps came to hospital because they didn't feel they had any other choice. Sometimes the expectations from patients and loved ones really didn't match what a hospital admission could achieve. For most life-limiting illnesses, and certainly as dying becomes closer, there are a series of possible and predictable events that may happen. What the PACT form is about talking through these scenarios with patients who have capacity and documenting their wishes, i.e. planning ahead for care and treatment. The PACT form can also be used for patients without capacity, and in fact was designed initially for this purpose. The conversation then being had with those that know the patient best to try and ascertain what the patient would want if they could make decisions for themselves. The form, once completed, stays with the patient. It should be documented in the hospital and community notes that such discussions have taken place and a form has been completed. The form is then easily accessible to be referred to by patients and their families, but also by clinicians such as ambulance staff and out-of-hours GPs if needed. The PACT form is to be used in conjunction with other advanced care planning documentation and DNA CPR forms. It's similar to other initiatives across the country, such as the Respect form, but is perhaps more useful because it documents a specific plan for a specific situation. The PACT form can be found on the hospital intranet or at GP practices. We will now demonstrate an example of a PACT conversation with a relative of someone without capacity.
Hello Mr. Green, my name's Dr. Wyatt. I'm one of the consultants in the hospital. Thanks for coming in today, I really appreciate it.
Hi, I'm Fred, I'm Molly's grandson. I'm quite keen to sort of see where she's at and what's going on.
Sure. Tell me, what's your understanding so far, Fred?
So the nursing home phoned me and they'd said that she got quite unwell, quite confused. So they told me that they'd phoned the GP initially. This was the night before last.
Okay.
And that the GP then said to call the rapid response team, and I think that they phoned them, and I think the plan that came out of their assessment was to go into hospital by ambulance. So she went into A&E, and now she's on the ward, back on the ward. I think they phoned me last night to say that they think that she might have an infection, but they didn't seem 100% sure. But I know that they were concerned because she's quite agitated. She's not really herself.
Sure.
I don't think she wants to be, on the ward maybe. She seems to be asking to go home. That's where we're at, as far as I know.
That sounds really distressing, Fred, isn't it?
Yeah, it is, yeah.
And I was reading that Gran's been in the same situation a few times over the last few months.
Yeah, I'm worried because every time she leaves, she gets a little bit more disorientated, a bit more frail.
Yeah.
Doesn't
Not
do
quite
well.
herself, maybe.
Yeah.
Okay. I saw that too from reading through the hospital notes. I spent some time with Gran this morning, and she's unable to tell me much about herself. She's quite muddled. So I thought, if she can't tell me what would help, maybe I should talk to those around her that can help and can tell me what would be important to her.
Yeah.
I saw you were down as next of kin.
Yes, that's right. I live quite close by because my my dad, her son, he lives in Scotland, so he can only sort of visit when he can, when he's able to.
Tell me, before Gran became muddled, did she give you or Dad or anybody else for that matter lasting power of attorney? So that's when people give permission for people to make decisions on their behalf should they not be able to. So decisions about health or about money. And then this is registered with the Office of the Public Guardian.
So the conversations were being had about having that, and then what happened was, we were planning to do it, is that the dementia that she kind of got, it came quite quickly and quite strong very early on,
Okay.
so it didn't kind of transpire in the end.
So that didn't happen.
No.
That's helpful to know. Tell me, did Gran, before she became muddled, write down what might be important to her should she become more poorly? We call that an advanced decision or an advanced directive.
No, not as far as I'm aware.
No. Okay, not to worry. So tell me a bit more about your Gran. Help me understand who she is and what kind of person she is and what makes her happy.
She's really amazing, actually. She, unfortunately, she was widowed when my dad was 3 years old. So she kind of had to work a few jobs to give him sort of his upbringing.
Sure.
She always worked really hard. She loved cooking. She was a great cook. She baked the best cakes ever. She loved puzzles. She loved crosswords.
Yeah.
She was very outdoorsy. She loved being outdoors. She chaired. I think she was the chairwoman of the local WI for years, and she only really retired when she was around 80.
Wow.
Because she was still doing some of the books for some kind of firms and stuff like that. It was about 3 years ago that she started to fall. So we all, as a family, decided that it was probably better that she goes into a home.
Sure.
And she started getting a bit more confused around that time as well, which I don't think helped. But then she went into the home and she was initially quite social, she didn't engage in activities. And then sort of the past year, she's really kind of gone more downhill. I think not only with her dementia but also general health.
Sure.
I think she sleeps in the chair a lot of the time. I don't really think it's her anymore. She gets quite upset in hospital. It's quite unfamiliar and noisy for her. I don't really think that she'd want to be if she had a choice.
Would not want to be here if she had a choice. What do you mean by that, friend?
I don't think she would. No, she was very independent. She was a feisty person. She wouldn't like the fact that people are caring for her every need and cleaning up after her in hospital. It's noisy. It's not her. It's not her home.
No, not her.
Yeah.
Okay. What do you think she would want going forward if she could tell us?
I think if she could tell us, I think she wouldn't want to fuss beat me. That was always her. She'd just get on with it. I think that if it's her decision, I think that she'd probably rather go back to the nursing home where the people know her, where she knows them. At least they are familiar faces. They're in a familiar environment.
Sure.
Yeah.
So being cared for in a familiar environment by those that know her best.
Yeah, I think so.
Yeah, that sounds like a good plan. That sounds like a good plan. Tell me, have you thought through what might be ahead for Gran? Is that something you want us to talk about?
I know that she's getting poorlier and poorlier, and I don't think now at her stage in her life, I don't think she's going to go the other way and improve too much. So I know that we don't have years left.
Okay.
I'm very aware of that.
Yeah. Sure. I think you're right. I would suggest that time might be short, actually.
Yeah.
We know that people who come in and out of hospital over a short period of months often have months left.
Okay.
We know those who spend more time in a chair or in bed than up on the feet often only have months left. Yeah. Which I think it makes it more important, doesn't it, to get this time right for Gran.
Yeah.
And to do what's right by her. And to focus on what would make her feel better. Yeah. I'm wondering whether we start to write some of these things down so everyone's got a plan to follow.
I think that'd be a good idea.
I've got a form that we call a PACT form, so it stands for planning ahead for care and treatment.
Okay.
And it's not about not coming back to hospital, if that's what's needed. It's about doing the right thing for the right person at the right time.
Okay.
Okay. So this is the form. Let me show it to you.
Okay.
Let me just fill in Gran's details. So what we do is we think of problems that might pop up and we come up with a plan. Okay. So one problem that might pop up is that if Gran had another stroke, for example.
Yeah.
Yeah, because I know she's had some of those in the past.
Yeah.
I think if Gran had another stroke, that could be managed in the nursing home actually. Because I don't think a hospital would offer anything extra.
Yeah, I agree.
Yeah, so let's write that one out. So if Gran had another stroke, Actually, the thing would be to stay at home.
Okay.
I guess another problem that could happen is that Gran could develop another infection.
Sure.
And this is something where hospital treatment might be different. Hospital treatment is different to home treatment.
Okay.
So in hospital, we've got the antibiotics through the veins, through that cannula that Gran's got.
Yeah.
And they're stronger antibiotics generally than those by mouth. But in my view, the harm of coming into hospital for Gran is probably bigger than the help that the IV antibiotics will give.
I think so too.
Because I think if Gran's sick enough to need IV antibiotics, she's probably pretty close to dying.
Yeah.
And I wonder whether she would prefer to do that in her own home.
I think so.
Yeah? Okay. So let's write that down then. If Gran was to develop another infection, then we would give her antibiotics by mouth, but we wouldn't bring her back to hospital.
Okay.
Antibiotics through her veins.
Yeah. Okay.
Do you think that's what Gran would want?
I think so, yeah. I think she'd want to stay, yeah.
I think that another thing that might happen is that Gran may start not to want to eat and drink in the same way, not to feel hungry in the same way. Yeah. And again, I wonder whether actually a hospital admission to have a drip doesn't change the reason why she's not wanting to eat and drink.
Yeah, it doesn't fix the problem.
It doesn't fix the problem. So I wonder whether we manage that differently and we allow the care home to expect that to happen and to manage it in the care home.
I think so, yeah.
Yeah. So let's write that one down too. So we've got a problem about stroke.
Yeah.
And we'll be going to send the care home. We've talked about what to do with infections. And we've talked about what to do if Gran doesn't want to eat and drink in the same way. Okay. This box is about cardiopulmonary resuscitation. I know people have had a few conversations with you over the past about this, and we'll absolutely make sure the form goes back with Gran to the nursing home this time.
Yes, thank you. Yeah.
So I'm going to tick that box. Okay. And then this next page is about mental capacity.
Okay.
So Gran hasn't got mental capacity. She hasn't got the ability to make her own decisions.
Yeah.
She can't, unfortunately, take information in, use it, and then tell us her wishes, which is why we're talking to you about these things. So I'm going to tick the no box for that.
Okay.
Gran hasn't got a lasting power of attorney either, so I'm going to circle no for that. But I'm going to put you down as someone as a significant other, and your phone number here.
Okay.
If that's okay with you?
That's fine, yes, thank you.
And then I'll write a summary here and suggest that we review this plan every month or so in case there's other things that pop up that we need a plan for.
Yeah.
Okay. And then I'm going to make sure the GP knows about it,
Okay.
the nursing home know about it, and I'll photocopy it, put in the hospital notes.
Okay.
And then this form will go home with Gran to the nursing home along with her DNA CPR form.
Perfect.
Does
Thank
that
you
sound
very much.
alright?
I think that sounds like a brilliant plan.
Yeah. Do you have any other questions about it?
No, actually.
No. Okay, well if you do, let me know. And again, if Dad wants to have a chat about it again, just let me know.
Perfect.
Okay.
Thank you very much.
Thank you.